This is a telephone consultation. Samantha sent a photograph of her head. You can see that the problem is hair loss, right? So when you're seeing this case, it's important that you have some knowledge base so that you understand what are the questions you need to ask and how you're going to manage this scenario. So if a patient is presenting with hair loss, there are a few things we need to be thinking about. So whether this could be due to anxiety, what about the patient's diet and nutrition? Is there any family history of hair loss? We also need to understand whether there are any possible triggers to this. If you don't know this, then it's going to be difficult for you to take a targeted history. So it's not just about your consultation and communication skills. It's also about how much you know about the case scenario, especially the clinical experience group. You also need to be thinking about various differential diagnoses. So there's telogen effluvium. This is when there is excessive shedding of the hair. And there's also underactive thyroid pathologies that could cause hair loss. Anagen effluvium, this is when there is no hair growth. Typically, this happens due to chemotherapy or cytotoxic drugs. So once you know the differentials, you understand what could be the potential diagnosis, then you're able to take a targeted history. So when you will take your history, then it will help you to understand whether it could be due to the patient is anxious, whether the patient may be on a medication that could cause hair loss. And then you may consider arranging investigations. So investigations that you might want to consider would be blood tests. So let me know in the chat what type of blood tests you might request for this patient. TFTFBC, iron. Okay. Yeah, ferritin is also a good one. Yeah. Okay. So these are blood tests that you want to arrange to identify whether there is any deficiencies in iron, zinc, or it could be hormonal problem. Then based on your assessment, then you may consider treatment. So treatment could be with um, potent steroid. It depends on what you think could be the cause as well. So as you can see, you also need to have a good knowledge base when you're sitting the SE exam. Practice makes perfect. This is a common myth. Now, practice helps, but practice on its own, if you just keep practicing the same thing, then it's not likely to be giving you the results that you want. Meet Dr. Inamuna Berega. He was stuck in training for years. He failed his RC exam 4 times. Imagine failing the exam 4 times and having your CCT delayed over 2 years. This had many consequences, not only on his training, but on his personal life. He was not really in the mindset that would help him. And also, the odds of passing for him was not in his favor. As an IMG, the odds of passing was not great. So out of interest, what do you think is the pass rate for IMGs for the clinical component of the MLCGP exam? Okay, so you're saying 49, okay, 62, right? So it is actually less than 50. So for the RC exam, it was 49.6. And for the CS exam, it was 44.1. So the new exam, we don't have the data yet from the college, but it's not looking great for the SE exam because we already know that the pass rate is low. So if you compare this to a UK graduate, it's quite a stark contrast between 91.6 and 49.6. So there were a lot of sacrifices and it did affect Dr. Inamuna's financial state. It also affected his confidence and his career was on the line. As you may be aware, you can only have 4 attempts of the MRCGP exam, the clinical assessment. And it's only exceptionally that you may be given a last 5th attempt. So his career was on the line. And it was not because he was not practicing and practicing and practicing. He was working hard. But the problem is he was working on the wrong things. And that's a major problem, especially among people who have failed the exam multiple times. If you keep doing the same thing and working hard, then it's problematic because you're stuck in training when you could be earning six figures as a GP. You're having a loss of income of 50 grand per year, which is quite a large loss. And also, it's affecting your personal life as well because there are other people who depend on you. For example, if you have other dependencies and you have to apply for visa extension, it's a large cost. So Dr. Inamuna was going through a downward spiral after failing the exam four times. And to be fair, he was working hard and didn't give up, which is says a lot about his resilience. So the problem in his preparation was he was not getting feedback. And without constructive feedback, he didn't know what was wrong in his preparation, and he was just practicing and working on the wrong things. But once he identified the missing piece of the puzzle, then he was able to use the insight to adjust his consultation, implement the changes, and consult and get better results. And eventually, he passed his exam and had a really good score, 164 for the RCA. And as you can see in the breakdown of the score, he did not fail any of the cases. He had a really good pass, and that was his fifth attempt. But you don't have to sit it fifth time to get there. You could do it first time and don't have to have this problem if you do it right. So that's why it's important that you identify your areas of weaknesses and you get support and guidance so that you know what you're doing wrong, because everybody has got the blind spot. And if somebody doesn't identify it for you, then you might think that you're doing well. When the results come, then you're shell shocked.
Hi, everyone. My name is Dr. Inamuna Beraha. This is just a quick testimonial about Dr. Erwin Kwun's coaching program. I think I went through the coaching program in November 2021 because I was struggling with the RCA. I was on my fourth attempt. I had one last attempt, which was my fifth attempt. I had experienced coaching before then in terms of life coaching in general, just setting goals and things like that. And I had seen the benefit in terms of cutting through the fluff and then just going kind of straight to the point in terms of what you want to achieve. And then having the coach kind of encourage you to draw the solution from yourself. So I think I had a good experience of coaching and awareness of coaching before then. Found this as videos on YouTube. Because of the challenge I was going through, decided to go through his coaching program, which was over 3 sessions, over 3 weeks. I found it quite beneficial because the feedback that he gave was personal to me. I could apply it instantly. I think the feedback was also quite succinct. It wasn't like vague. It was very clear. I think I had the privilege of coming back to improve on whatever I had done, like the work we had done the previous week. I can put it in practice the next day of work or the next week while recording for the RCA or while recording for the exam, and also come back and kind of get more feedback. In that way, I was able to build on the progress I was making. So I'm just thinking, if you feel like coaching is for you, or you want someone to guide you through the process, if you feel like there's any kind of aspects of the consultation that you may be struggling with, or even if you're not sure of what is going on, what's wrong with your consultation, and you just need someone to explore that with you, to get some coaching so you can find the solution and then act on it. It's a program I would definitely recommend.
Are you feeling anxious about the SCA preparation? Maybe you're not getting constructive feedback, you don't know whether you're doing the right thing. If you're looking for one-to-one support, I'd love to help you. Click the link down in the description below to book a call with me to see how I can help you to pass your exam.